Welcome back with another practice question. This is one of the types, that is eliminate the comparable and alike options. So the question goes like this. The nurse is caring for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk for fluid volume excess. So we can see the options. The first one is the client taking diuretics. The second one is the client with an ileostomy. And the third one is the client with kidney disease. And fourth one is the client undergoing GI suction. See, the test taking strategy is we need to focus the subject and we should see the risk for fluid volume excess. So when thinking about the pathophysiology, about the each and every options which is given here, the option 1 taking diuretics, the option 2 client with ileostomy, and the option 4 the client undergoing GI suction, these all pathophysiology which linked with the fluid depletion, means the fluid is lost in one or the other form. The only option, that is the client with kidney disease, this pathophysiology holds correct, that is the fluid volume excess. With this particular selection of the option, the rest where the three options are alike, right, which is having fluid volume depletion, and the third option which is opposite. So this is something which is different from the first, second and the fourth one. So the third one is the correct answer. By going in detail with the pathophysiology with the question, so we can achieve the right answer is number 3. So we need to remember one thing, that we need to eliminate the comparable and alike options with the help of pathophysiology, what we have learned from the content. Here I am with another practice question for you, which is under the professional standard in nursing. Here the question goes like this. The nurse is caring for the client in an emergency department who presents with a complaint of fatigue, a shortness of breath, and which physical assessment findings is, if noted by the nurse, warrants the need for follow-up. And the options here are: first one, the red and sclera of the eyes. The second one, dry flaky noted on the scalp. And third one, the reddish purplish mark over the neck. And the option 4, the scaly rash noted on the elbow and the knees. From these options and from the question, we can see that the client is screened for abuse. We can see from the question that there is some discoloration near the neck, and the patient is also very fatigued, and he is complaining of shortness of breath. These all gives a clear picture that the elderly person is being battered or being abused. We can usually see this type of persons experiences a reddish around the eyes, the scleras are becoming red. We can see anything of red or purplish mark over the neck, and we can see a sprained or broken wrist, and there is a chronic fatigue with this type of patients, shortness of breath and a muscle tension and involuntary shaking, and there is a change in habit of eating and sleeping, and there may be many mental health issues also with such type of patients. We can see they are increased risk of post-traumatic stress disorder, and they have a lot of nightmares and anxiety. They are very much depressed, and they are having very low self-esteem, and they might be under the influence of alcohol or drug abuse. So rest of the options doesn't pose any emergency. It is a usual finding with some of the other disease conditions, but the option 3, which is alarming, which indicates the patient is being abused. So we need to check these type of questions and arrive at the correct answers, which will help us in cracking the answer. Hi friends, here I am with another question practice, which is on safety. It is under the subtitle Management of Care. So here the question goes like this. The nurse has received the client assignment for the day. Which client would the nurse assess first? And the options here are: the client who has nasogastric tube attached to intermittent suction. The second one, the client who needs to receive subcutaneous insulin before breakfast. Option 3, the client is in second post-op day and is complaining of the incisional pain. And the option 4, the client who has blood glucose level of 50 milligram per deciliter and complains of blurred vision. So with these options, we need to select the question which type. That is, the question is the management of care under the category of safe and effective care environment. So the strategic word we should select from the question is the first. So with this strategic word, we need to establish the priority by comparing the needs of the each clients, and we can arrive at the correct answer. The option 4 is the right answer because this patient, the assessment and the treatment is at the priority because the blood sugar level is extremely low, which needs to be attended. I will not deny that option 1, 2 and 3 options patients are not at to be attended because they also need assessment, but I think that these patients can wait until the option 4 patient need to be attended and treated, so these patients can wait. So the option 4 becomes the most priority and under the safety. So today we are with another practice question which is on infection control. Here I am going to introduce about the umbrella option. This umbrella option we are going to practice in this question. We can see the question. The client admitted to the hospital is diagnosed with a pressure injury in coccyx and has a wound vac. The wound culture results indicate that methicillin resistant Staph aureus is present. The wound dressing and the wound vac foam are due to be changed. The nurse would employ which protective precautions to prevent contraction of infection during the care of the patient? So the options are gloves, a mask, and second one is contact precautions, third one is airborne precautions, and fourth one is face shield and gloves. So these all the options are which is mainly given in the way of protective equipments itself, but we need to select a particular option which is covering with the particular disease condition which is given in the question, that is methicillin resistant Staph aureus. We should focus on the client diagnosis and use the knowledge about the particular diagnosis and recall that this infection spreads through direct contact. So with this particular recall, we can take precaution to use gloves, gown for a routine care, and we can use gloves, gown and face shield if there is any splashing anticipated during the provision of care. So the option here is second, that is contact precautions. This is an umbrella term. So as I said earlier, the umbrella option is a broad and universal option which includes the concepts of other options. So the answer is a contact precaution, which is an umbrella term. Remember friends, there are other options are also correct, but one particular option we need to select which is most appropriate to the condition which is given in the question. So this is the most appropriate type of answering in this type of questions. Thank you.